Hello everyone. I just want to explain today about the FAST coding where we find, we have to code their infusion, injections, hydrations. I think most of the people are confused. Even I was also confused about it. So this video hopefully will, clear your confusion about the infusion, right? So infusion is basically seems like a confusion, but yes, hopefully this video will clear your confusion. So I just on the screen you can see this is the AIMA website, and I'm going just through this website. So I think this is very good website to explain each and everything with examples. So today through this video I'm just going to give you an overview how to code this CPT and what are the hierarchy while coding the ED facility. So basically these CPTs are coding while coding the emergency department ED facility, right? It's called facility coding. So during the ED facility 99281 to 285, we have to code these ENM labels, but along with that, we have to pick these CPTs of infusions, injections and hydrations, right? So what is the hierarchy basically? Chemotherapy is coded first, then infusion, then injection, and then hydration, right? Chemotherapy CPT 96401, this is the initial CPT, infusion 96365, 96374 for injection, and hydration 96360, right? I would request you to go through these CPTs and you will have better description there. So coder must master many term definitions. For example, infusion. What is infusion? Injections, IV push, IV PB, which is called IV piggyback, intramuscular injections. So I would request you to go through this website and clear your confusion. How you will identify this is infusion, this is injection, this is IV push, and this is intramuscular injections. So I am just going a brief introduction about it. Infusion, administration of diagnostic, prophylactic, or therapeutic intravenous fluid and or drugs given over a period of time. Example, banana bag, heparin, nitroglycerin, antiemetics, antibiotics, etc. Right? Injections, the act of forcing a liquid into the body by means of needle and syringe. Right? IV push and IV administration of therapeutic, prophylactic, and diagnostic. And infusion that run for 15 minutes or less. So 15 minutes or less infusion will be coded as IV push, right? Intramuscular injections and injections of therapeutic, prophylactic, or diagnostic drug into the substance of muscle, usually the muscle of the upper arm, thigh, buttock. Intramuscular injections are given when the substance need to be absorbed quickly. Hydration. What is hydration? Typically an administration of pre-packaged fluid and or electrolyte without drugs. Example include normal saline, sodium chloride, NaCl, dextrose 5% in water, D5W, dextrose in half normal saline, right? And dextrose in half normal saline plus potassium, right? NSN plus K. So the coder must also throughout understand the guidelines provided by the American Medical Association. You can go through these entire web page. I hope you are able to do the link. Now, what are the important key points to know? The coder will need to determine three things initially. What are those? What did the patient receive? Means while coding the infusion, injections, and hydrations, you have to check. You have to go through the entire report, and you have to just take out these points that what did the patient receive, whether it was injection, whether this was hydration, whether this was infusion, what was this? You have to identify from the report, and how was it given, what was the way, how was it given, means whether it was infusion, whether it was in intramuscular injection, whether this was in IV push, or whether this was hydration, right? How long did it take, and what was the total time it was given, right? So these three things you have to clear out of the report, right? And to determine the initial code, there are few things that coder need to consider. First, was there an infusion 16 minutes or more? Then if you have determined, then you have to check, was there an infusion of 16 minutes or more? If so, Infusion 96365 should be coded as it outrank both injection and hydration, because first we have to give the priority to the infusion in the hierarchy, right? Then if there was no infusion, means while coding you are just going through the report and you find there is an infusion of 16 minutes, then code 96365. If you don't find any infusion is there, and if you find that there is an infusion but less than 16 minutes, then you have to code 96374, which is IB push. So if there was a no infusion, was there an injection? If so, injection 96374 should be coded as it outranks hydration, right? So before hydration, you have to sequence, injections. If there were no infusions or injections, was there a hydration of longer than 31 minutes? If so, then hydration 96360 should be coded. Hope this is clear so far. Subsequent IB push are then coded as appropriate. So I just wanted to explain you this table, right? Maybe most of the people must be aware of it, but this would be useful for those who are confused or who are new to the ED facility. So hierarchy for subsequent or subsequent IBP, right? So sequence would be first infusion will be coded sequence first, then IB push, and then hydrations, right? So first code of infusion, initial code is 96365. So what is the criteria to code this? Minimum 16 minutes must be there to code infusion CPT 96365. So 16 minutes to 1 hour 96365 will be coded, and then additional add-on code we have 96366 for each additional hour. So each additional hour at least should be 31 minutes to 1 hour. We have to code 96366, right? 96367 for sequential infusion up to 1 hour. So sequential, if you you find that there is a drug which is infused for 1 hour, and then you also find that there is another infusion of different drug, then you will code 96367 for up to 1 hour. Use 96366 for additional hour for sequential infusion, right? So 96366 will be coded after 9. If you have coded 96367 sequential drug, then after that if you want some code, you want to code some additional hour apart from the 96367, then you have to code again 96366 for additional hour of subsequent sequential infusion, right? So it means 96367, if you think that there are additional time for 1 hour, right? Additional time apart from the 1 hour, then you have to code 96366 along with 96367. 96368 for concurrent infusions. It means if multiple or if more than one infusions going together, then in concurrent, it is called as concurrent. And then 9636 will be coded for concurrent infusion and report only one per encounter. So in a DOS, in any DOS, you have to only code single CPT of 96368. You cannot code multiple CPT in a DOS of 96368. Single CPT on a same DOS, you have to code only single CPT of 96368, right? You can code multiple CPT of 96366, right? But you cannot code multiple CPT of 96368 in a DOS. Nice. Then we go for 96375, 96374, 96375. 96374 is just IB push. IB push is what if there is any infusion less than 16 minutes, we have to code that 96374. And I just go back, 96365, we must have start and stop time. If we have start time for infusion and we don't have stop time for infusion, any infusion, right, more than 16 minutes, sorry, if we don't have stop time for infusion, then we cannot code that infusion. We have to code that as IB push, right? So in order to code the infusion, we must have start and stop time. If there is no stop time, we cannot code that as infusion 96365. We have to code that IB push 96374, right, or 96375. So for 96374, minimum criteria, less than 16 minutes. If less than 16 minute infusion is there, you can code 96374. 96374 5 for additional IB push, additional drug, new drug. If new drug IB push is given, then of new drug, then you will code 96375. 96376 for same drug. if you have, one IV push has been given of one drug, and same drug has been given again, okay, okay, through the IV push, then we have to code 96376, but there must be 30-minute difference between, two similar IV push of same drug. There must be the difference of 30 minutes. Okay. So next one is hydration. 96360 is the CPT, initial CPT. 96361 is the additional CPT. In order to code the hydration 96360, in at least 31 minutes must be there. If there is no 31 minutes, we cannot code hydration, right? So start and stop time must be there. So for 31 minutes to 1 hour, we will code 96360 for initial, CPT of hydration, and then each additional hour. So additional hour must be at least that two should be at least 31 minutes long, right? So from 31 minutes to 1 hour for additional 96361 will be coded, and then 96372 for the injection, IM subcutaneous injections, and 90471 is for intramuscular subcutaneous, vaccines, right? So it is very important to note this thing, that in any case with an IVP injection, infusion or hydration along with an IM or subcutaneous injection, the IM or subcutaneous injection will require modified XU for unusual overlapping services. 96372 XU modifier, right? So you can see in while wherever you are coding in any company, wherever you are coding the ED facility, there may be some different guidelines to some extent. So, if there is something, your client or your company or clients say that you have to do these things, so at least follow those guidelines. These are the standard guidelines. If there is any change in your in your facility or your, it differs client to client, right? So if a client say that you have to do this way, so go as per to that guidelines, right? So these are the standard guidelines of HIMA. So we also have some important point. Then we will show you some examples through the another video, so keep watching. So some important point that coder need to know. As the coder pick the appropriate column and follow it down the appropriate codes, they must also remember that it is critical to look at the chronological order of infusion in order to determine the correct codes. It is just as important to pay close attention to the times of infusion. In order to accurately code infusion, not only must there be a start time usually documented, but there must be stop time, right? This is very, very important. If there is no stop time, we cannot code any infusion, and this is most problematic in most EDs. So you need to check, in order to code the infusion, you must have a stop time, else you will code the IV push. An infusion or hydration that run alone with no IVP interrupting will be counted by minutes from the start time to the documented stop time, right? So infusion and hydration guidelines is there. If the both run alone with no IVP, interrupting will be counted by the minutes from the start time to the documented stop time. If the patient is transferred or admitted to another patient, status count from the start time to the time that the admit order is written. Some facilities consider admit time as the time of the admit order, otherwise may count the time from the actual transfer of the patient. Hope this is itself is understood. If hydration was interrupted by either an IVP, very important, if the hydration is interrupted by IVP or IVBP, Vicky pack, you must count only the time the hydration ran alone. So if hydration was interrupted, means in between the hydration, while hydration is given, in between that, if IVP or IVBP is given, then you must count only the time the hydration was ran alone. You have to subtract the time of IV push. The time rule is still applied. It must run for 31 minutes for the hydration. For each IVP that is given during hydration, subtract 15 minutes from the normal saline time unless multiple IVPs are given within 15 minutes of each other. Means for each IVP that is given during the hydration, if the duration, same duration while hydration is running, during the same period, if IVP is also running, then we will subtract 15 minutes. If both are running together, then from the same time, then we have to subtract 15 minutes out of the hydration as per the IMA rule, right? So hope this is clear to all of you. If you have still any confusion, you can mention in the comment section, right? So that's all from my side, and keep watching, and I will from the next through the next video I will explain you the example. I think that will make you know more clear. So I would say subscribe my channel, like and share. So I'm going to say bye. Thank you so much for watching this video.